Hello everybody, I am Roberto Ferrari from the University of Ferrara, and I'm here to tell you that to have elevated blood pressure is bad. It damages the heart, the brain and the kidney. And the problem is that you do not feel the level of pressure in the pipes of your body. For this reason, hypertension or high blood pressure is considered the silent killer. This is because there is too much salt in your meal. So please, my message to you is please reduce the salt in your meal. Cook with less salt. Remember, this is an S.O.S. Step down with your salt. It's very important for your health. Of course, this can be done, and Dr. Mayank Jain will tell you how to do it.
Hello everyone, I am Dr. Mayank Jain, consultant nephrologist working in Jodhpur Medical Hospital. Hypertension is one of the most common cause of cardiovascular mortality and morbidity, and hypertension is one of the most common cause of kidney failure. And salt intake is the most important factor for contribution to hypertension and to the causes of uncontrolled hypertension. By controlling and limiting the salt intake, you can control the hypertension and you can decrease the cardiovascular mortality and morbidity. And by very little steps, we can decrease the intake of salt. Like we stop adding salt in our rice and our roti, chapati and extras. Limit the intakes of processed food, preserved food, which have a high intake of salt as a preservative. Particularly in Western Rajasthan, we should limit the intake of papad, chutney, namkeens, which are very high source of salt intakes. And by removing the added salt in our food, we can definitely decrease the intake of salt, and by that we can decrease the risk of hypertension and complications related with hypertension, particularly related to kidney disease. So in nutshell, I want to say that by adopting the simple measure to decrease the salt intake, we can control our blood pressures very well. Thank you.